Okay, here we go. Now I start this screen share. Hello, everybody. I'm so glad you're here. Let's start this here. Welcome to our Friday afternoon presentation. So happy you are here. We are at the wrong slide. Let's go back. Here we go. Let's start from number one. That's always a good idea, not in the middle, but from number one. Kelly, would you be so kind and mute everybody?
Yes.
Thank you very much. Okay, let's get started. My name is Kat, Dr. Kat. I'm a holistic doctor of pharmacy. I have been a pharmacist for over 35 years. Herbal medicine was from the start part of my repertoire. Then I added on homeopathy, Ayurveda, TCM, spagyric, anthropic medicine, and many other modalities. And I really liked a lot the homeopathy and the idea behind the homeopathy, which is giving the body a frequency, a remedy with a frequency that helps our body heal itself. I always like that idea because I always believed in the fact that our body is actually created perfectly to heal ourselves. Then later on, I added energy healing because also energy again is crucial. We are energy, and energy does so much to us. And I'm so blessed that I was praying and hoping and envisioning a company like Avini for the last 6 years. Having found it's like my prayer have been heard. I feel blessed. And today we have the presentation together with Mary Crawford, which is awesome. I'm so happy to have you here, Mary. Would you introduce yourself real quick?
Absolutely. Yeah. I'm Mary Crawford. My business is The Joy of Being Well. I've been an energy healer for over 3 decades. Started out as a special ed teacher, got into nutrition for many years, and I became a master dowser. So I use dowsing in all of my work and teach dowsing as well. But what I do is I read bodies, I connect with people's bodies, and I can help them understand what their body really wants. And I'm always, when I bring in a new product like Avini, I'm always looking at the energy of it. And the energy of the Avini products is off the chart. It's just so high. So I just absolutely love working with products that have this really high frequency. I know they're going to really help people. And so I'm excited to be part of this.
Yes. All right. What we want to look at first is where did modern medicine or Western medicine get us to from about 1950, 1960 to today, 2024. So let's take a look at that.
Yes, and this chart can be crazy overwhelming sometimes, but look in 1960, there's almost no money being spent on prescription drugs. And then look at where we are today. It's absolutely ridiculous, and we know that there's all the side effects that come along with that. So we're not getting healthier. We may be living longer, but we're not getting healthier.
And that's exactly the point. Modern medicine got us to an extended lifespan from 65.6 years on average in 1950 to 79 years today. But if we look at the health span, it actually got a little bit downhill to only 63 years. That means that we lived the last 16 years of our lives on average in poor health. And that's something I do not like and I don't want to experience. I want to be healthy and fit and feel vibrant my entire life, and I want to live long on top of it.
Absolutely. So why is there that 16-year gap? Prescription drugs target the symptoms and not the cause, and that's the problem.
What if you would know the underlying cause of the diseases, and what if there was an easy, safe, and effective way to address that cause? Would that be something you'd be interested in? If yes, put a 1 in the chat. I want to see that. I want to see what you think about that.
Yay, there's a one.
Yeah,
One,
yeah,
yes.
yeah, yeah, yeah. Yeah, there come. Yes, yes, exactly. Let's go ahead and find out. Thank you so much.
So, yeah, yuck. You don't want to be breathing this stuff. You don't want to be eating it. Toxic. A toxin is a chemical substance which damages an organism. Are you toxic? That's kind of a moot point because we know from the research that everybody has toxins in their body, even brand new babies. So we'll get into that more. But the environment is making us sick.
Hallie Arlington, would you read this?
Sure. Every time we breathe, eat, drink, wash, exercise, get dressed, go to work, or climb into bed, we expose ourselves to potentially harmful substances, air pollutants, synthetic chemicals, contaminated food and water, radiation, pharmaceuticals, alcohol, noise, microplastics, and microorganisms, to name but a few.
Whoa, I mean, I get dizzy by hearing that. I don't know how you feel about it. So there are the common sources of toxins are non-sticky cookware. It's really everywhere. It's the heavy metals are in and chemicals are in our drinking water, in our food, from the weed killers and pesticides. We even have many of us in the past had, or maybe even today have amalgam dental fillings, which are full of mercury. It's in the car exhaust, it's in the BPA in the plastics, and really everywhere, in the cosmetics, in lotions, potions, and everywhere.
So you can really go online and find documents like from the FDA, the US Food and Drug Administration. Mercury poisoning is now linked to skin products. So that's skin creams and beauty and antiseptic soaps and lotions that might contain mercury, or after products from the toxic metal turned in at least 7 states. So this is from the FDA, and you can find a lot more of this evidence online. You go and look for it.
Another shocking fact is sunscreen. I have been knowing this for decades because in Germany we sell high quality sunscreen in pharmacies and always warn people of the cheap sunscreen, which has a lot of hormone disrupting and even estrogen elevating ingredients, which can lead to even bad cells, especially the breast for women. It has nanoparticles, and this is something, again, we don't fully know yet what these nanoparticles are going to do to our bodies, because they can go through barriers other particles can go through, and they might do much more damage than we know today.
Okay, so there are over 86,000 environmental toxins, and the EPA has the power to regulate harmful chemicals under the Toxic Substances Control Act from 1976. However, they've only banned 9 of the 86,000 environmental toxins. And that just sucks. Sorry. 4 billion pounds of toxic chemicals are released into the environment yearly, including 72 million pounds of known carcinogens. So if you just look at these lists here, we have the heavy metals on one side, we have the chemicals on the other. These things are everywhere around us, and it's really hard to avoid them.
To name a few examples, it's in rice, especially in brown rice, it's more loaded than the white rice. We all know there's a lot of mercury in fish. It's in fruit juice, and we all think leafy greens are so healthy, and they're good for us. But if they're loaded with heavy metals, they're probably not that good.
Baby food. Can you imagine feeding your baby lead and arsenic and cadmium and mercury? Yuck. Protein powders. We think those are supposed to be really healthy things, but some of them have high levels of heavy metals. And spices. Yeah, spices are very concentrated forms of plants. And so when you concentrate and dry the plant, you're also drying in all of the heavy metals that might be in that plant. Bone broth. When you boil bones, you are leaching out all of the things that are in the bone, including the toxic chemicals and the heavy metals. So yeah, sorry.
Another thing we all believe that it's more healthy than the not dark chocolate variants. So the dark chocolate, they found a lot of cadmium in many of the different dark chocolate brands. And really shocking for me was the organic variant. I always try to buy organic food because I hope I'm safer with that. But it seems like not always. I mean, it's still usually a better alternative. But as the toxins and heavy metals are everywhere, they are in the soil, in the water, in the air, and we can't avoid it. And it gets even into the organic products.
Right. And this is really shocking. I mean, look at these versions of really common foods, and these are often foods that parents were giving to our kids. For instance, the macaroni and cheese. Kat pointed out to me that the enriched macaroni product that's in Kraft macaroni is not even really macaroni. It's a enriched macaroni product. So who knows what that is? And then you've got sodium I can't even read all these things.
That's already a bad sign.
Sodium phosphate and triglycerides and medium chain triglycerides. Yeah, galactic. Yeah. But anyway, and yellow and two different kinds of yellow dyes versus the one in Great Britain is macaroni, wheat, and whey powder, and salt and paprika. So yeah, the oatmeal is just as bad. Read your labels, people, and know what you're actually eating yourself and feeding your kids. It's kind of scary.
Yeah, the restrictions in Europe are way up than they are here compared to the United States. So now the forever chemicals, or PFAS, we are surrounded by them too. They have the name forever chemicals because they stay in our bodies forever if we don't find a way to get them out. And they also don't change. They won't be changed through metabolism or anything. So they would just stay in our body and do all kinds of harm. And on the left-hand side, you can see where they are in some examples. It's almost impossible to avoid them. They can lead to organ damage, bad cells, inflammation, and development problems in the development of our unborn children.
Yeah, that's sad. So what happens when good cells go bad?
It starts with the fact that many of the couples nowadays don't even get pregnant anymore. The fertility went way down from 1960, 7 to 8% infertility rate. We had in 2021 an approximate 30% of infertility, which is pretty shocking. And I mean, that really shows how unhealthy the cells are in general if it can come to conception. And then if it comes to conceptions, the birth defects are way up. And all this is due to the pollution and all the toxins we have in our bodies.
Yes, and everything that the mother is exposed to, the fetus is exposed to. And we now know that an average newborn has over 200 different industrial chemicals, pollutants, and pesticides in their blood. These are carcinogens, they're toxic to the brain and the nervous system, and they lead to abnormal development. And if you're living in an urban area like New York City, chromosomal abnormalities in infants can be really high. So yeah, we gotta do something.
This shows that shocking new research has linked exposure to heavy metals like cadmium, lead, arsenic, and mercury with a higher risk of autism for our kids. And we saw the numbers really ticking up. So many more children struggle with this kind of diversity and problems in their mental health.
And heavy metal exposure contributes to mental illness, including depression, anxiety, bipolarity, and schizophrenia. So, yeah. I mean, I don't think we even think about that too much. The fact that what we're putting into our body affects our depression and our anxiety, but it's so true, and we see it all the time.
And that's not all. It also contributes to cardiovascular disease. Heavy metals like arsenic, cadmium, mercury, and lead can increase the blood pressure, which is dangerous. We all know that.
And the National Library of Medicine is telling us that epidemiological studies demonstrated an association between heavy metal and organic pollutant exposure, and the incidence of obesity and metabolic syndrome. So those of you who are dealing with weight issues, what if it's heavy metals that's actually the problem?
Yeah, it is actually in a way that when we first ingest the heavy metals, they float around in our blood system. And if it gets too much, our body is trying to store them. And most of them we store in our fat cells. And if there are not enough fat cells, so now our body holds on to more fat cells so it can store more of the heavy metals. It also has a link to diabetes. Cadmium and arsenic are primarily accumulated in the liver, kidney, and pancreas once they reach the human body. And that, of course, means that it has a harmful, we are processing sugar in a more harmful way.
So diabetes in the USA is going absolutely crazy. In 1960, less than 2% of the population was diabetic. In 2024, almost 12% of our population has diabetes. That's just insane.
Okay, let's look at what everybody is afraid of. That's bad cells. Nobody want to have this diagnosis. And here is again a link. Heavy metals can lead to DNA damage and therefore lead to bad cells. Also oxidative stress, which means inflammation. That's always a very bad sign. If we have inflammation, our body can't heal itself easily, and the cancer cells we develop on a daily basis can't be eliminated anymore. Another thing are pesticides. They can as well interfere with hormones, damage the DNA, and cause inflammation, and eventually lead to bad cells.
But that's not all. What about all the little nagging discomfort and disease that you might be feeling? You can think of any disease that you don't want to have and put it in a Google search and add heavy metals, and you'll always find a correlation.
Yeah, that's a shocking thing. There was never an exception. And we have to be clear, we cannot get rid of the pollution in our world. It's impossible, at least not in my lifetime or in our lifetime. It's not going to happen. And even good nutrition, we saw this, even if we try to just eat organic food and drink cleaner water, there is no really clean water, but cleaner water, and all of this we don't get around. It's not enough. We still accumulate all these toxic substances inside of our body.
So the good news is that Avini Health has a solution for your body's pollution.
And it's a rhyme. All right, when bad cells go good. That's so beautiful.
Okay, so reactivate your natural healing. We were created perfectly prepared to heal ourselves. We don't face any roadblocks. So this happens if we don't face any roadblocks and our cells are clean and healthy. That's the important part.
So the solution seems to be logical, right? As soon as we can remove those roadblocks and release the body burden, we should be fine, right? But how? The traditional detox we hear about, all these cleanses, they don't work. They just move the toxins around in our body, and then we feel all these debilitating side effects like nausea, flu-like symptoms, and even more discomfort. And again, the good news, Avini has an answer.
Right, and it's our cell defender, which is clinoptilolite zeolite, which has been named detoxolite. It captures, contains, and removes heavy metals, VOCs, the forever chemicals, EDCs, and all the other toxins easily, safely, effortlessly from your body. And there are 15 clinical studies to prove this.
And that's pretty amazing. I got to add this because if a company has just one clinical study, they are already very excited. We have 15. Cell Defender is nature's purifier, and has been known for hundreds of years. And in our case, it's the cleaned, activated, and micronized variant. Our wonderful biochemist developed, and it's ready to remove everything chemical that doesn't belong in our bodies. We have already sold over 8 million bottles, and we have over 1,400 testimonials in just 2 years.
So Cell Defender, everybody needs it. We call it the tip of the spear because it removes toxins from the blood and from the lymph system. It raises the body's pH and supports the immune system. It's purified, activated, and micronized in a 3-day, 34-step process. And again, you've got all those clinical studies, which you can find on our website. So if you want to go read them, they're there.
Before we go on, let's give Rick Deitch, our expert, the word.
Hi, my name is Rick Deitch. I'm a biochemist, and I'm a little different in the field because I'm both a nutritional and a pharmaceutical biochemist. What I want to talk to you about today is natural zeolites. So first of all, what are zeolites? So zeolites are naturally occurring compounds. They're formed usually in volcanic eruptions when ash and lava goes into salt water, and over thousands and thousands of years through heat and pressure form crystalline lattices, a crystal shape that becomes a natural zeolite. So zeolites are unique for a variety of reasons. First of all, they form a cage-like structure. If you saw this crystal, it's got a lot of space inside. Now, not only does it have that crystalline shape and that cage-like structure, it also carries a negative charge. So because of zeolite's cage-like structure and its negative charge, it has the ability to draw to itself and trap within itself a variety of different compounds, primarily heavy metals. Now, we use a zeolite called clinoptilolite. Clinoptilolite, because of its cage-like structure and the pore size of that particular zeolite, just loves toxic heavy metals like mercury and lead and cadmium and arsenic. And it doesn't like the good metals like calcium, magnesium, phosphorus, sodium, potassium. It's really good at separating out the good from the bad. The reason is the smaller the metal and the higher the charge, the greater the affinity for the zeolite. So it just so happens that all the things that are bad for us are small with a high charge, and all things that are good for us are bigger with a lower charge. So even though clinoptilolite has this huge history of traditional medicine, traditional use in detoxification and things like that, we know there's problems with it. When I first started looking at zeolites in the 90s, I looked at clinoptilolite and I looked at some products that were basically capsules or powders that had the clinoptilolite in it, and I knew there were problems with it. The first problem is it was too big. The powder that comes out of a zeolite mine site is usually anywhere from 5 microns to 200 microns, like a rough granular sand. That's way too big to be absorbed from the digestive tract into the bloodstream. I came up with my first process, a micronization process. So using high pressure and centrifugation, I crush the zeolite over and over and over again to make it smaller and smaller and smaller, where my average particle size is smaller than a micron, and the smallest particles are as small as 390 nanometers, 0.39 microns. That's certainly small enough to be absorbed from the digestive tract into the bloodstream. Now, since I launched my zeolite, there's been dozens of competitors that came to market, and they all claim the same thing. They use my research and my studies to try to support their products. But in every one of these cases, we've not been able, in any single case, to identify zeolite in the bloodstream of people using those products. So we don't know if that even gets in. We just haven't seen it. The second problem with the natural zeolites is that they're dirty. Zeolites are really good at sucking up toxins and heavy metals. So even in the zeolite mine site, anytime air blows through that mine site and water flows through it, the zeolite's sucking up all those toxins and heavy metal. And if you don't do some sort of cleaning process, that's in the finished product. Now, I'm not saying they're dangerous because the zeolite is so good at holding on to them, it's not exchanged out into the body. But if it's already full of all those high affinity compounds, how much can it take out of your body? How much detoxifying can it do? So in our lab, we came up with our activation process. We use high heat and ultra purified water and natural acids to first drive off the volatile organic compounds and then to force the exchange of heavy metals for good metals. So the best analogy I can come up with this process is look at a kitchen sponge. So if the sponge is dirty, if it's full of stuff, how clean is it going to be able to get your kitchen, get your counters? But if you take it to the sink and you rinse it out, and you clean it out, squeeze it out, now it's got tons of room, tons of space in it to be able to clean your kitchen. That's kind of what we do with our proprietary micronization activation process. And I have to tell you, no one else does this. Since I launched my zeolite product, my first commercial zeolite product in 2004, we've been knocked off dozens of times. And we've looked at every one of those products. And in many cases, we can't even find zeolite in the product at all. And when we do, it's something that hasn't been micronized or activated. In many cases, people say they don't have to activate the zeolite because it comes from a pure source. Well, there's no such thing. There's no pure place or pristine place left on Earth. When we clean out the zeolite, we actually measure what comes out of it. And in one batch, we saw some volatile organic compounds come out, and we measured it, and it came back as diesel fuel exhaust, which means even the manufacturing equipment that's mining the zeolite is creating toxins that are being pulled into the zeolite. So unless you're doing a process like ours, an activation process, that stuff is in the final product. Now, our product has actually been around since 2004. It's the subject of 15 clinical studies, and 3 of the studies we actually wrapped up into one study that was published in a peer-reviewed journal, and that study is available. But we've looked at this time and time and time again for its benefits, and the 3 major benefits are pretty basic. It removes toxins and heavy metals from the body, therefore making the body healthier, and a cleaner, healthier body fixes itself. The second thing is, through that activation process, we actually help stabilize pH, and we make the body more alkaline. And you want the body in an alkaline state, which puts it into an antiviral, antibacterial, anti-cancer state. And then lastly, it helps support and stabilize your immune system because of those other mechanisms. This product is something that when people find out about it, everybody wants it. Everybody needs it. Everybody on the planet, and this is the only yeah.
Thank you, Rick Deitch. We're going to get to him. We also have a few more products. We have something else for immune support. Automatically, the detoxolite will support our immune system, but we have in addition more products. We have something to get our body hydration, something for severe pain, chronic pain, weight management, for energy, for our cardio health and mind and vision. And of course, also something for our furry friends, the pain relief and the cell defender.
So Rick Deitch says a clean and healthy body can fix itself, and that's what we're looking for. Avini Health is designed to take out what doesn't belong in the body and substitute what we lack in the highest quality and the most effective dose.
And here he is, Rick Deitch. He's our formulator and CSO. He is a pharmaceutical and nutritional biochemist, and he has over 25 years development in the category of detoxolite, which is his trademark clinoptilolite zeolite. And he started actually his career in cancer treatment, research, and development.
And then we have the really, I don't know what you call them, the heads, the life force of our company, the guys who helped put it all together. Neil Roth, our CEO, is a nuclear physicist with over 45 years of top executive positions in multi-billion-dollar companies. And Doug Dickey, the VP of Sales, has 20 years of experience as a CEO, CFO in fertilizer and plant nutrition companies. And he invented high-tech, environmentally safe products. And both of these men have had incredible experiences with these products that have been life-changing for them. So we have amazing leadership here.
Yeah, that's why they are so passionate about it, because both of them got a second chance in life because of them. That's our facility in Boca Raton, Florida, established in 2022, May 1st. It's FDA and CGMP regulated. Everything is in-house, from manufacturing, testing, packaging, distributing, and it's an over 18,000 square feet facility. And here we wanted to share a really, really beautiful testimony with you guys. That's another 5 minutes. Hang in. It's awesome.
Hi, my name is Brianna McCandless. I am a wife and a mom of 4. Several years ago, I had noticed some things changing in my body, which were a little bit alarming. I ended up starting to lose my hair, and it wasn't just a little bit of hair loss. It was a whole lot of hair loss. I ended up losing over 80% of my hair. And I started to notice some other things that I was having a hard time with. My gut would hurt anytime I ate anything. I had really struggled trying to just finish my sentences, remembering people's names. It was so embarrassing. Even my husband and other people were noticing that my brain fog was so bad. My kids noticed. I wasn't able to get out of bed unless I set my alarm about an hour before I was due to get out of bed, just because I was so exhausted all the time. I went to multiple doctors trying to figure out what was wrong, because I felt like something was just really wrong with my body. And they kept saying, well, it could be postpartum hair loss, or you're tired because you've got twins. And I thought, I've been a mom before. I know what postpartum hair loss and losing 80% of your hair is not it. And I know that I've got 4 kids and I know that I'm tired, but this is beyond being tired. On top of that, every single time I got up during the day, my whole body hurt from my head to my toes, my joints hurt. And I'm not very old. I shouldn't be experiencing extreme joint pain. I didn't really feel like that was normal. I had all of these different tests done. They tested my thyroid. They would do different blood panels. And every time they would come back and they would say, oh, everything looks normal. You're probably just tired. But that really wasn't good enough for me. So I kept going and I found a doctor who finally said, have you ever had an inflammation panel done? I said, I've gone all these tests, but I have not had an inflammation panel done. So let's do it. And when I got my inflammation panel back, I found out that I had some autoimmune issues that they had discovered in my testing. They also found out that the inflammation levels in my body were so high that they couldn't give me a number. The test only went up to 600 and my levels were off the charts. And so I was super excited, which is kind of a really weird way to act. But I thought, awesome, we know what's wrong with me, so let's fix it. We can fix it and make it go away. And they said, well, these things that we found are things that you're going to struggle with your whole life. We can kind of treat the symptoms, but you're always going to have flare-ups, and this is just what your life's going to be. That also was not good enough for me. So I started going through their protocols with different antibiotics, different IV therapies, changing my diet. I did all the things. And although it took some of those symptoms away, I was still left not feeling 100% myself. And I was also left in a lot of debt. About 6 months after I finished up with my IV therapies, I started to have flare-ups again, just like I had never done anything before. And they said, well, you got to come in for another round. And with having 4 kids going into IV therapy twice a week for 3 hours and sitting there and finding a babysitter twice a week for 6 weeks is a little bit of a struggle. So someone, actually one of my neighbors, introduced me to Avini. And I thought, there's no way that this special rock juice or whatever they're trying to sell me is going to work. But I thought, well, okay, think about this. It's a lot less expensive than my IV therapy. And you know what? There's a money back guarantee. So I'm going to give it a shot. So the first week I started taking it, I was pretty faithful and I didn't notice anything and I was really discouraged. But the second week I was able to get out of bed without setting an alarm, and I didn't need a nap. And that was huge for me because normally I had to have a nap in the middle of the day. Then I noticed that my gut issues started to go away. Then I noticed that my memory started to come back and I was remembering people's names and why I was talking to them. And I just thought, what is this stuff I'm taking? This is insane. And then all these things that I was dealing with from my bloating, and my hair started growing back. All of this is mine. I don't have to wear wigs anymore, which has been phenomenal. My skin cleared up and my joints stopped aching, and all these things that I was struggling with anxiety and depression, it started to lift, and I felt like I was coming out of this fog. And I'm happy to say that I have been using Avini products since I think it's May of last year. I am off all the medications that I was previously put on. I have not had any flare-ups since I started taking them, and I have my life back. And it's all because of a little bottle and someone that was kind enough to share the message of Avini with me. And so I get to be with my kids and I get to be the mom that they deserve. And I'm thankful for what Avini's done in my life.
Okay, so why would we choose direct marketing? First of all, because the products need explaining, and it's great to have that support of somebody who knows you, that you trust, and can really help you. There's no external interference from that middleman, and everybody benefits when we use this kind of marketing program.
So now it's up to you. What's your next step? Do you want to learn more? Then please get back to the person who invited you here. Do you want to expand your lifespan by becoming a customer? Or do you want to become a member and expand your health span and be a blessing to others?
So can I make a recommendation?
Get your Cell Defender and try it out. You have nothing to lose, everything to gain, and a 30-day money-back guarantee.
Thank you.
Thank you so much. And again, get back to the person who invited you here to this presentation. Thank you. Thank you.
Thanks, everybody, for being here.
Yes, thank you so much. All right, I'm going to stop the recording.